What if your body has been warning you about diabetes every single morning, and every single morning you've been flushing the evidence away? Most people believe diabetes is something you find out about through a blood test, a number your doctor calls you about, a result on a lab slip. And that's not wrong, but it's not the whole picture. My name is Dr. Chima Okoye. I'm a nephrologist, a kidney specialist, and I've spent over 20 years watching what happens when blood sugar goes uncontrolled for too long. What I can tell you is this: the kidneys register blood sugar problems earlier than almost any other organ in the body. And morning urine, collected before food, before coffee, before anything else has entered your system, carries some of the clearest early signals available, if you know what you're staring at. I've made today's video because I've sat across over 200 patients who had every sign for months, sometimes well over a year, and dismissed each one as a perfectly ordinary part of getting older. By the time they reached my office, the damage was no longer early. That delay has consequences that cannot always be reversed. One of my patients, an 89-year-old retired lawyer, a woman who jogged 16 miles every morning and considered herself in good health, came in complaining of fatigue and swollen ankles. Before I ordered a single test, I asked about how her morning urine looked. She looked at me and said, "Dr. Okoye, I just thought it was age. Everything changes when you get older, doesn't it?" Her A1C came back at 9.1. Based on her kidney markers, she had almost certainly been living with undiagnosed type 2 diabetes for close to 2 years. Her story is not unusual. According to the Centers for Disease Control and Prevention, nearly 4 in 10 adults over the age of 65 in the United States have diabetes, and a significant portion of them don't know it yet. Today, I'm going to walk you through 9 signs that may appear in your morning urine. What most people assume each one means, what is actually happening inside the kidneys and the bloodstream, and one daily habit for each sign that you can act on immediately. Let's get into it. The first sign is one that almost everyone has seen at some point and almost no one takes seriously: foam. Persistent bubbles in the toilet bowl after urination. Not a single ring of foam that dissolves in seconds, but layered, stable bubbles that sit on the surface and don't disappear. Most people who notice this assume it has something to do with water pressure, or the angle at which the stream hits the bowl, or simply air being introduced into the water. They've seen it before. They've seen it their whole lives, off and on. It seems mechanical. It seems like nothing. For many older adults, that assumption has been quietly costing them years. Here's what is actually happening. The kidneys contain millions of tiny filtration units called glomeruli, microscopic meshes designed to clean the blood and retain what the body needs, including protein. When blood sugar remains chronically elevated, those filtration membranes sustain damage over time. They weaken, gaps form, and protein, specifically a protein called albumin, begins to slip through into the urine. Protein in water produces foam. It is the same physical principle as the foam on a raw egg white when it's agitated, or soap residue trapped in rinse water. When the mesh is intact, albumin stays on the correct side. When it's compromised, it passes through and announces itself visibly every single morning. This is called proteinuria, and according to the National Kidney Foundation, it is one of the earliest measurable indicators of diabetic kidney disease, often appearing years before other symptoms become noticeable. Think of your kidney's filtration membrane as a fine window screen. A new screen keeps insects out. A screen with tears and stretched openings lets things through it was built to stop. Chronically high blood sugar slowly tears that screen. Foam in your urine is the torn screen telling you something has changed. The daily habit is straightforward, but it requires consistency. Beginning this morning, not next week, this morning, take 30 seconds before you flush. Look, stable foam that remains after 10 seconds is worth noting. Keep a simple log on your phone. Date, yes or no. If it occurs more than 2 or 3 times in a week, bring that log to your doctor and ask specifically for a urine albumin to creatinine ratio test. Do not describe it casually. Use the words persistent foam, possible proteinuria. That language will move things forward faster than a general complaint. The second sign is something many people have noticed, briefly, and then explained away before the thought fully formed: a faint, sweet, or fruity smell to their morning urine. The dismissal is almost always the same: something from the night before, fruit with dinner, a glass of juice, a dessert. The explanation feels logical and complete, so it gets filed away and forgotten. That is exactly what makes this sign so easy to miss. What's happening involves two separate mechanisms working at the same time. First, the kidneys have a reabsorption threshold for glucose, a set capacity for pulling sugar back out of the urine and returning it to the bloodstream. Think of a rain barrel with a fixed overflow spout. Below a certain fill point, the barrel holds everything. Once blood glucose consistently exceeds approximately 180 milligrams per deciliter, the barrel overflows. Glucose spills directly into the urine. This is called glycosuria, and the American Diabetes Association identifies it as a direct threshold indicator that blood sugar has exceeded what the body can recapture. Second, when cells cannot access glucose properly, the body begins breaking down fat for energy. That process produces compounds called ketones, which carry a distinctly sweet, faintly acetone-like odor. The morning urine sample, concentrated after 6 to 8 hours with no fluid intake, makes both the glucose and ketone presence stronger and more detectable than at any other point in the day. The daily habit here starts at the toilet and ends at the kitchen. Beginning this morning, be intentional about noticing smell before you flush. 2 seconds, nothing more. If sweetness is present, the second step matters immediately. Do not skip breakfast, and do not make it high in simple sugar. An uncontrolled blood sugar spike first thing in the morning compounds the overnight accumulation. Whole protein, healthy fat, fiber, eggs, avocado, plain Greek yogurt. If the sweet odor recurs across multiple mornings, tell your doctor that morning urine, not a random sample, has been carrying a consistently sweet smell. Request a fasting glucose and a ketone check. Do not wait. The third sign is one that nearly every adult over 70 has encountered, and nearly all of them have attributed to the same cause. Dark, deeply concentrated urine in the morning. Amber, tea-colored, sometimes approaching brown. The explanation almost writes itself. Not enough water yesterday. A busy day. Forgot to drink. It's one of the most common sense dismissals available, and for an isolated occurrence, it may be accurate. But when the color is persistently dark, morning after morning, even on days when fluid intake seemed adequate, something else may be driving it. High blood sugar behaves osmotically. It draws water. Think of the way coarse salt draws moisture out of a cucumber left to sit. The salt doesn't move toward the water moves toward the salt, pulled by concentration difference. Glucose in the bloodstream works by the same physical principle. It pulls water out of surrounding cells and tissues to dilute itself. The kidneys, working to eliminate that excess glucose, excrete it with large volumes of fluid, a process called osmotic diuresis. The body loses water faster than it takes it in. In adults over 70, the thirst mechanism is already less reliable than it was at 40. The result is a state of chronic, mild dehydration that persists even when a person believes they're drinking enough. And that dehydration shows up most visibly, most consistently, in the concentrated color of the first morning void. Research published in the Clinical Journal of the American Society of Nephrology has identified osmotic diuresis as a compounding dehydration risk in older adults with poorly controlled blood glucose, increasing vulnerability to kidney stress and acute kidney injury. The morning habit is timed and non-negotiable. Place a glass of water, not coffee, not juice, water, on your nightstand before you go to bed tonight. The moment you wake up, before you stand, before you check your phone, drink it. 16 ounces. Then observe your urine color. If darkness persists across multiple mornings despite consistent morning hydration, that pattern is clinical information. Write it down and bring it to your doctor as exactly that, a pattern, not a single incident. The color of your morning urine after 70 is not background noise. It is data. The fourth sign is one that is easy to rationalize away because, unlike foam or odor, it requires no special attention, just a glance at the wrong moment in the wrong light. Urine that appears cloudy, murky, or visibly unclear rather than transparent. Most people who notice this don't call their doctor. They blame the porcelain, the lighting in the bathroom, something they ate or drank. They file it under the long list of small bodily oddities that seem to resolve on their own, and they move forward with their day. The problem is that in many older adults, it doesn't resolve. It recurs. And the recurrence is a signal the body is sending without the accompanying alarm system most people expect. When blood sugar remains chronically elevated, the urine becomes a sugar-rich environment. Sugar is fuel, not just for the body, but for bacteria. That environment invites bacterial growth and sets the stage for recurring urinary tract infections that, in adults over 70, frequently present without the classic symptoms younger patients experience. No burning, no urgency, no obvious pain. Instead, a quiet, low-grade immune response, white blood cells mobilized, cellular debris shed, and the result is urine that looks like it has been stirred. Think of an unrefrigerated container of broth left out on a warm afternoon. At the right temperature, with the right nutrients present, bacteria multiply without any visible signal until the liquid itself changes. The clarity you had that morning is gone by the next. That is what sugar-rich urine does to the urinary tract over time. According to research published in the Journal of Urology, older adults with poorly controlled blood sugar have significantly higher rates of recurrent urinary tract infection, and in many cases, a change in urine appearance is the only presenting sign. Starting this week, not next month, this week, make note of cloudiness on 2 or more consecutive mornings. If you see it, increase fluid intake immediately and contact your doctor before the week is out. Ask for a urinalysis and glucose screen together. Do not wait for burning or pain that may never come. The 5th sign is the one that disrupts sleep, disrupts recovery, disrupts daily function, and yet gets accepted with a kind of resigned familiarity that I find genuinely heartbreaking. Waking 2, 3, sometimes 4 times a night to urinate. This is the sign that patients have almost always normalized completely before they ever mention it to me. A 76-year-old man I saw 3 years ago, a retired engineer, calm and methodical, summed it up the way many do. Dr. Okoye, I figured that's just what happens when you get older. My wife does it too. He had been waking 3 times a night for 2 years. He had adjusted his sleep schedule around it. He had stopped mentioning it at annual checkups because it had become part of the background of his life. It should not be background. Here is what is actually happening. When blood glucose is chronically elevated, the kidneys are forced to filter and excrete that excess sugar continuously, not just during waking hours, but through the night, every night, without pause. This is not a weakened bladder. It is not a prostate issue, though that gets blamed frequently. It is a filtration system running at maximum effort with no recovery cycle. Think of a sump pump designed to run intermittently being forced into continuous operation. The mechanism isn't broken, but it was never built to work without rest, and running it around the clock accelerates wear the manufacturer never accounted for. The American Urological Association has identified nocturia, defined as waking 2 or more times per night to urinate, as a clinically significant early indicator of diabetes in adults over 65, particularly when frequency increases gradually over months without an obvious trigger. The habit change here has 2 parts. In the evening, avoid all fluids containing sugar, including fruit juice, sweet tea, and anything carbonated after 7 o'clock. In the morning, record how many times you woke and write it next to your urine observations. Frequency plus appearance tracked together is far more persuasive clinical information than either detail alone. Bring that record to your next appointment. If you don't have one scheduled, make one now. The 6th sign is the one that generates almost no concern at all, because to most people, it seems like good news. Noticeably larger volumes of urine than usual, filling the bowl, feeling like the bladder has been completely emptied. Patients interpret this as the system working exactly as it should. A 78-year-old woman told me with genuine satisfaction, "Dr. Okoye, I just figured I was finally drinking enough water. I thought it meant everything was working properly." She had been producing abnormally high urine volumes for months. Her blood glucose, when we tested, was critically elevated. When blood sugar exceeds the renal threshold, the point at which the kidneys can no longer reabsorb glucose and return it to the body, glucose spills into the urine and does not pass through quietly. It pulls water molecules with it in large volumes. The result is urine that is produced in excess, diluted, and glucose-laden, not because the body has achieved proper hydration, but because it is hemorrhaging fluid to manage a sugar load it cannot contain. Think of a drain on a wet floor that doesn't just clear the standing water, but keeps pulling, drawing in fluid from every direction, more than the floor ever had on it, because the gradient keeps demanding it. The kidneys are not performing well in this scenario. They are being overwhelmed, and the high output is the evidence of that overwhelm, not the evidence of health. Research published in Diabetes Care, the Journal of the American Diabetes Association, identifies polyuria, abnormally elevated urine production, as one of the cardinal early presentations of type 2 diabetes in older adults, frequently appearing before a formal diagnosis is ever made. The habit is immediate. Beginning today, pay attention to volume, not just color or clarity. If you are filling the bowl consistently and noticing unusual frequency alongside it, that pattern belongs in a conversation with your doctor this week, paired with a request for a fasting blood glucose measurement. The seventh sign is the most counterintuitive one I will mention today, and it is the one that has caused the most damage in my patients because the existing advice they had been given pointed directly away from concern. Urine that is completely colorless, clear as tap water, in the morning. Patients are proud of this one. Dr. Okoye, I always thought clear meant healthy. My daughter's been telling me to drink more water for years, and I assumed this was proof I was finally doing everything right. I understand why. The message about hydration and pale urine has been repeated so consistently that it has become reflexive. But in adults over 70, persistently colorless morning urine, at the very time of day when urine should be at its most concentrated after 6 to 8 hours without any fluid intake, is not proof of perfect hydration. It may be proof that the kidneys have lost their ability to concentrate urine at all. This is called impaired urinary concentrating ability, and it is a recognized marker of advancing kidney stress. A healthy kidney, after a full night without fluids, conserves water and produces darker, more concentrated output. A kidney under sustained diabetic strain loses that efficiency. It keeps running, high volume, low control, producing dilute output continuously because the mechanism that adjusts concentration is no longer functioning the way it should. Think of a water filtration system designed to process fluid in measured, efficient passes. When that system is damaged, it doesn't slow down, it runs constantly but no longer concentrates anything. Fast movement, diminished function. The National Kidney Foundation identifies impaired concentrating ability as a measurable early signal of diabetic nephropathy, kidney disease caused directly by diabetes, and stresses that it frequently goes unrecognized precisely because the outward sign looks, to most people, like a positive result. The morning habit. Check your urine color before drinking anything today. Completely colorless, consistently, across multiple mornings, that is a data point. Write it down. Bring the pattern to your doctor and ask specifically about kidney function testing alongside blood glucose. I want to pause here for just a moment, not for a medical reason, but a personal one. We are 7 signs in, and I want to ask you directly, have you noticed any of these in yourself or in someone you love? Go to the comments right now and type where you are watching from. Just that. It tells me where you are, and it tells others watching that they are not alone. I read every comment on this channel personally, and if today's information has been useful to you, please click subscribe. It is the only way this reaches the people who need it most. Now let's keep going. The 8th sign is recurring urinary tract infections. Burning during urination. Symptoms improve with antibiotics, then come back weeks later. Dr. Okoye, I've had 3 UTIs this year. My doctor just keeps prescribing antibiotics. I assumed it was normal with age. I hear this often. The infections are real and antibiotics help treat them, but they do not explain why the infections keep returning. High blood sugar can spill glucose into urine, creating an environment where bacteria like E. coli grow quickly. In older adults, the immune system also responds more slowly, making infections easier to develop and harder to fully clear. The cycle repeats. Recurring UTIs can sometimes be an overlooked warning sign of uncontrolled blood sugar. Studies cited by the Infectious Diseases Society of America note that repeated UTIs in adults over 65 are associated with undiagnosed or poorly controlled diabetes. If you have had 2 or more UTIs this year, ask for a fasting blood glucose test along with any urinary testing. Do not assume antibiotics alone solve the problem. The 9th sign is the one that stops people mid-step, the one that creates a moment of genuine alarm, and then almost immediately gets talked down from the inside. A faint pink or red tinge in the toilet bowl, color where there shouldn't be any color. Almost everyone who has seen this has also found a way to explain it away. I saw it once and thought maybe it was something I ate, beets, red juice. By the next morning it was gone and I just didn't think about it again. I understand that impulse. The explanation is available and the sign disappeared. But visible blood in urine, even faint, even once, even when the next occurrence never comes, is never something to explain away. It is always something to act on. In the context of elevated blood sugar, blood in the urine, hematuria, can indicate that the small blood vessels inside the kidneys have sustained enough damage to begin bleeding into the urine stream. The kidneys are dense with microscopic vasculature. When blood sugar has been high for months or years, those vessels sustain wear from the inside, gradual and visible deterioration, like a corroded seal inside a pressurized system that looks intact from the outside until the pressure finds the weakness and fluid begins to seep through. Hematuria can also signal a UTI, kidney stones, or in some cases, a condition that requires urgent evaluation beyond diabetes alone. The American Urological Association is unambiguous on this point. Visible blood in the urine of any adult over 70 warrants same-week physician evaluation without exception. The cause matters less than the response time. If you have seen any pink or red tinge in your urine once, recently, or some time ago that you never reported, call your doctor within 48 hours. Not to schedule something for next month, this week. Tell them you have seen blood in your urine and that you want a urinalysis and a kidney function panel. That phone call is not an overreaction. It is the correct action. And going forward, regardless of what that evaluation finds, commit to one daily habit for kidney health. 8 glasses of water spread across the day, every day. It is the single most consistent protective measure available to you outside of medical management. One of the hardest parts of this work is sitting with a patient who has had 7 or 8 of these signs for more than a year and is learning about them today. Not because they were careless, not because they didn't care about their health, because no one had ever told them what to look for in something they saw every single morning and flushed away without a second thought. That is what today is for. Tonight, before you go to sleep, think back over this list honestly. Tomorrow morning, before you flush, take 10 seconds. Look at the color. Check for foam. Notice any odor. That is all. If you see or feel anything on today's list, call your doctor tomorrow morning. Not next week, tomorrow morning. What you have spent decades building, your independence, your presence in the lives of the people who depend on you, the things you are still here to do, that is what is worth protecting. Diabetes caught early, before the kidneys have sustained serious damage, is manageable in the majority of cases through diet, hydration, movement, and medication when it is needed. That window of manageability is real, it is documented, and it is exactly what closes when signs like these get dismissed for another year. If today's information reached you, share this video on Facebook right now and tag one person, a spouse, a sibling, a parent, a friend over 70. You may be giving them something this morning they didn't know they needed. A new video goes up every week on this channel, conversations I have with patients in the clinic that most people never hear outside of a medical office. Subscribe and bring someone you care about with you. I'm Dr. Chima Okoye, nephrologist. The kidneys don't ask for much. Pay attention to what they're already showing you. Thanks for watching.